Good morning, everyone. The topic for today's discussion is on Consumer Protection Act, which is commonly known as the CPA Act or the COPRA Act. Okay. So I hope you might have all seen this. This ad was there continuously in the last few years in the TV commercials. Jago, Jago. So it is the consumer which you have to, consumer who should be, consumer is responsible. Okay. So consumer has certain duties and it's consumer's duty to be alert. So the CPA Act of 1986, it is Act number 68 of 1986. So the Consumer Protection Act, it is actually regarded as a Magna Carta, okay, for checking unfair trade practices, any defects in goods and deficiencies in services in India. So it's an act of the Parliament of India, which was enacted in 1986 to protect purely the consumers of the country. Okay, it extends to the whole of India, but not the state of Jammu and Kashmir. It was passed in the Assembly in October 1986 and came into force on December 24th, 1986. It is an act of compensation. And I mean, it's an act, it's purely compensatory in nature. Okay. So it is intended basically to provide simple, speedy, inexpensive redressal to the consumer's grievances and relief to a specific nature and award of compensation wherever appropriate to the consumer. So the list of amendments of the 1986 Act are, which happened in 1991, 1993 and 2002. Okay. Recently, it replaced the Consumer Protection Act of 2019. Okay, and it was passed on 9th of August 2019 and came into effect from November 2019. So this is the one, 2019. Okay, now why are we studying it? Okay, or why does the medical profession or the dental profession need to be included in the Consumer Protection Act? That is the question of the hour. So the public awareness, why is it important is because public awareness of medical and dental negligence in India is growing nowadays. We have seen so many violences against doctors or what you can say, people get agitated fast these days. So, and also there are negligence happening from the doctor's side, right? So that is also, and the people are constantly finding ways. People have become tricky, in fact, you can say. So the hospital managements are increasingly facing complaints regarding their facilities or the standards of professional competence, their appropriateness of therapeutic and diagnostic methods. People have started questioning. Yes or no? So the negligence may be defined as a breach of duty caused by the omission to do something. When we say there is violence or against doctors, we are seeing just one side. On the other side, there are people who practice unethically. There are people who do negligence. So what is negligence? Negligence may be defined as a breach of duty caused by the omission to do something or doing something which is prudent, which a prudent, reasonable man would not do. Okay. So these are the meanings of negligence. And medical negligence, it arises from an act or omission by a medical or a dental practitioner which no reasonably competent and careful practitioner would have committed. So medical negligence and the growing knowledge of medical negligence gave birth to Consumer Protection Act in the medical profession. Hence, the necessity to provide for an alternative system which would be easily accessible, speed and cheap gave birth to the Consumer Protection Act for the healthcare services as well. Now, who is liable under CPA? The people who are liable under the Consumer Protection Act in the medical or dental professional are all the medical and dental practitioners doing independent medical or dental practices unless rendering only free service. Okay, all private hospitals charging all patients. Then all hospitals having free as well as paid patients. Okay, and all the paying and free category patients receiving treatment in such hospitals are liable. Then medical or dental practitioners and hospitals paid by an insurance firm for the treatment of a client or an employment for that of an employee is also liable under CPA. Then who is not liable is those hospitals and the medical practitioners, okay, of such hospitals which offer free service. If you're offering free service, then you're not liable. I mean, free service in the sense, total free service. So, redressal agencies are there under the CPA. Okay, so the major three redressal agencies are, or the Act envisages a three-tier quasi-judiciary. The final appeal is always for the under the hands of the Supreme Court. So you have a district level, state level, and a national level. So you have district forum, state commission, and national commission to hear the grievances of the consumer and provide compensation accordingly. Okay, so when we see the district forum, it consists of a person who is qualified or who has been qualified to be a district judge. Okay, that person should be the president of the district forum, and it should have two other members, one of whom should always be a woman. Okay, and they should have the knowledge and experience and capacity in dealing with problems related to economics, law, commerce, accountancy, industry, public affairs, or administration. So there is a president and two other members, with one out of the two members, one should be a female. So a complaint may be filled with the district forum by the consumer himself, or a recognized consumer association can file a complaint, or one or more consumers together. When numerous consumers have the same interest, they can file it together. Okay, so the jurisdiction of the district commission is, so they entertain complaints where the value of goods or services and the compensation which they ask for does not exceed 1 crore. See, that is a huge amount of money they are going to ask. Okay, so it should be if the complaint is for a value less than 1 crore, then you should be approaching your district forum. Now, next, the second tier is the state commission. The state commission, it will consist of a person who has been qualified to be a high court judge. Okay, high courts are usually for the state. So, a person who is qualified to be a high court judge will be there as the president. Then it will have two other members. So, two other members with qualifications and experiences within the state, and one of it should be a woman. So, the jurisdiction of state commission is, it will entertain all the complaints which exceeds 1 crore of value, but it should be less than 10 crores. So see, if you see, that is the compensation you will have to provide if a consumer went against you in the state court. So imagine the condition. Okay, so ours is a noble profession, and it is our duty to behave professionally and practically with ethics, right? So always keep this in mind. So if at all a complainant goes to the state court against you for any negligence from your side, okay, it will be somewhere between 1 crore and 10 crore, the compensation which you will have to provide. And the state commission will also take into consideration all revision petitions against the district forum within the state. Now, what is the procedure of hearing appeal by the state commission? Procedure of the state commission for entertaining original complaints is the same as that of the district forum. Appeal may be decided ex parte, that is one-sided, in case the opposite party fails to file a reply to the appeal or fails to appear himself or through his agent or advocate on the date fixed. Okay, that may happen.